and we'll get started in just a few seconds.
Good morning, everybody. Thank you all for joining us. As has so often been the case, we're entering a new phase in our fight against COVID-19. We're seeing a significant drop in cases here locally since their peak in this past winter. Fortunately, our vaccinations are continuing to rise. We're going to get the full numbers on those in a moment, and you'll see that we're gaining ground. I had to say all that with a big but, right? But we've got to keep pushing. We can't act like this fight is over. We're far from that. We are certainly in a better position right now than we were in January, but there is a lot of work left to do because certainly we know what the virus has no plans of going anywhere. It is constantly evolving. It wants to beat every strategy we throw at it. That's what viruses do. And there are multiple variants circulating that we'll be talking about later on here this morning. In some cases, these variants are more contagious. They're more deadly than the original strain of the virus. So we've got to keep track of those and keep doing the things that we know that work. So it always comes back to the basics when it comes to getting rid of the virus. And we know what that is. That means masking up in public, social distancing, washing your hands, avoiding crowds, and getting vaccinated as soon as you have the opportunity. And hopefully, as we continue to say this, people just aren't eye rolling and say, we know all that, because what we're seeing now is in many states in the country, case counts are going the wrong way. We happen to be doing a good job here locally and in the state, but that is not the case around the country right now, where you're seeing places like Michigan, South Dakota, New York, New Jersey, et cetera. Their cases are rapidly escalating. And we saw this also in Europe, and then 4 weeks later, boom, they're out of control again. So it's this fourth surge that we're all very concerned about, that you hear President Biden speaking to, Dr. Walensky at the federal level, the state level, it's Dr. Stack, Governor Beshear at the local level, myself, Drs. Moyer and Hartledge, and everybody on the call you'll be hearing from here today. So please, everybody, do your part. We are so close to getting past this thing, but if we don't do our part, we're going to have another surge. We don't want that to happen, obviously. Fortunately, there's a lot more vaccines that are coming on the way. We've got some announcements today about our approach to getting more people throughout the community vaccinated, because when you think about our vaccination technique, we started off with the big mass vaccination site at LUVACs. We started off with a focus on our long-term care facilities, on our healthcare workers. And we've got to evolve now, just as the virus evolves and just as the supply also now becomes more available with us. We got to start looking ahead to what we think might be getting in the way of achieving herd immunity in the community. And a big part of that will be people's avoidance of taking the vaccine when it's their turn. So we just want to constantly reiterate that the vaccines are safe. Well over 100,000 people were part of clinical trials with the vaccine in America alone. And right now, over 100 million Americans have received the vaccine. So everything is safe, good to go. Please get your shot when you get the chance. And when you think about what most everybody wants, which is to get back, quote, to normal, going to restaurants, going to ball games, concerts, what have you, we've got to get to that herd immunity number of 75, 85% in our community, in the country, in order for that to happen. That means everybody's got to get the shot when they get their opportunity to do so. That also will bring our economy back into the full condition that we want it to be as well. We've got good help on that, right? That's the American Rescue Plan that you've been hearing about. In Louisville, it's our Build Back Better Together plan that we've been working on for multiple months now to recover from the pandemic. That's the backbone for executing the American Rescue Plan here locally. And we'll be talking more about that in the coming weeks as this all fits together, which is the work to eliminate COVID-19 and the work to bring the economy back. And as we're bringing the economy back, to do that in a more equitable way than it's ever been done before in our history. So it's really a wonderful opportunity for us now that we have all of these resources, but we all have got to do our individual part to make sure that we get there. So let's start with the data, as we always do with the weekly shows here, so we understand where we're at. And to take us through that is Dr. Sarah Moyer, Director of Public Health and Wellness and our city's Chief Health Strategist. Dr. Moyer, take it away.
Thanks, Moyer. Or thanks, Mayor. You said Moyer, I said Moyer. Wanted to start with saying happy spring break week. I know everyone's enjoying a little bit of lighter traffic and hopefully time with family. Our case count this week is holding steady in that orange zone. We decreased very slightly with 754 cases being added. And so we're still holding steady in that orange category. We did have, unfortunately, 17 deaths reported last week. 12 of them are recent and 5 were the additions with the state audit. So slowly getting caught up on those, but still a high number of deaths that we're seeing in our community. And we know that right now, all of those are 100% preventable. And so just another reminder why we're still having weekly briefings here with COVID, just to remind us of the importance of the preventative measures and then also getting vaccinated. It's an exciting couple weeks up ahead, and I know we've got some great speakers on today to dive into more of that and opportunities we have. And so scrolling down there, again, going into the vaccination data, sorry, Scott, back up. So we slightly less vaccinated with the first dose last week. But more people receiving their second dose. So 28.3 thousand Louisvillians got their first dose last week, and 16.7 thousand received their second dose. So in total, over 100,000 people, or almost 16% of our population, have completed the 2-dose series, and 241,000 have received the first dose. This is about 31% of our total population and about 40% of those that qualify, those that are over 16. If you look at the maps, we can see where we have higher levels of vaccination and where we have our work cut out for us going forward. And these are just really important, not only because we're trying to get everyone vaccinated across our entire community, but Dr. Bartnagar will be on later showing that variants are spreading in areas where we have less vaccination. And we're just really trying to get everyone vaccinated as quickly as possible. Lastly, when you scroll down to the hospitalized patients, there were 75 patients that were inpatient across the entire community as of yesterday, 13 in the ICU and 6 on vents. Again, all of these hospitalizations are 100% preventable. So as a reminder, as we get into April coming up here, everyone right now who is over the age of 40, or if you're over the age of 16 and fall into the 1C category, which is many chronic medical conditions, including common things like asthma and hypertension, but it also includes a BMI over 25, which is not that high for our average Kentuckian. And so please check your BMI. Majority of people qualify in that. And so if you have not received your first dose yet and started the series, I encourage you to go on our website today. I know Norton's got appointments for later this week and next week available. And Dr. Smith is going to be on here in a moment to tell you about other opportunities. And so just a reminder as we go forward, I know many of you are waiting for our higher risk Louisvillians to get vaccinated first, but now is the time that we need to switch that and want everyone to get vaccinated. So please check out our website, find a spot for you to make your appointment and come in to get vaccinated. In the meantime, just keep up with that mask wearing and the spacing and the washing your hands. And if you travel or doing any other high risk activities, especially if you are not vaccinated, don't forget to get tested. Our testing capacity is still very high. And so make an appointment and you can get a test today for that as well too. So that's it, and looking forward to hearing from the rest of our speakers today just to share other great things going on and opportunities we have coming up.
Great. Thank you, Dr. Moore. One thing, obviously, it's been really emphasized throughout the entire pandemic is the importance of partners and the importance of our city to all work together to eliminate the virus. And I'm proud of how we've been doing that. When I talk to other mayors, there's nowhere near the type of alignment and strategy that we've got working together. So one of our great partners with that is the entire University of Louisville system, whether it's U of L Health, the medical school, all of the researchers. So we've got two guests from U of L today. I want to welcome the first of two guests, starting with Dr. Aruni Bhatnagar. He is the director of the Christina Lee Brown Envirome Institute and lead researcher on the Co-Immunity Project, a partnership whose goal is to track and curb the spread of COVID-19 in our community. It is a national cutting-edge project that Aruni is in charge of, and he's joined us many times throughout the crisis to update us on their findings. So Dr. Bhatnagar, welcome. Thank you once again for being with us.
Thank you, Mayor. Good morning. I just wanted to see if I can get my slides on.
All right. There we go. Looks like they're coming up. So
yes, next slide. So as you know, Mayor, we've been sort of looking at the rates of infection and around town for seeing where the different infections may be around the community in Jefferson County, and we've also been monitoring the wastewater. So just wanted to show you some of the recent results. Next slide, please. So last time when we met, I was telling you that we were getting a lower rates of infection across Jefferson County, and the rates have decreased. And we see a similar thing in the wastewater, but there are certain areas which we still see persistent high levels of infection. So although the infection rates have come down, we are maybe where we were in September or October. So it's not that we have made a very drastic change. We have actually gone over the surge of the winter, and we are back to where we're in the fall. So I think we still have a lot of ground to cover. The new problem that's cropping up, and can I have the next slide, are these variants that have cropped up in our community, and they are of different types. And there's the ones that you're really concerned about, and some of them not showing here is the ones in California, and there's also one that is from New York. And I can show you in a minute where we see these variants. Next slide, please. So we see that there are certain places we see significant, or at least a direct, clear signal that there is the presence of the variant. And this is the UK variant that's present on 34th Street and Wood Road and Terry Road. There is the California variant that is present in Ashby Lane and other places. So we see both these variants in our community. The sort of concerning part, especially the UK variant, is it is more infectious. It causes 64% more deaths, and the vaccine is very effective. It's about 85% effective against it. So that's the good news. The thing with the other variant, with the California variant, is that it's about 5 times more people infected with this are 5 times more likely to be hospitalized, and 11 times more likely to die if they have this variant. And it is sort of quite resistant to the antibody treatment, but the vaccines are about 50% as effective. So these are really serious issues that we need to consider, and these are very significant variants of concern. Next slide, please. So we can see that they're spread in different places. This is the UK variant, and the UK variant is present mostly in the south of the city, the southeast and the southwest. And you can see there are pockets where we can detect this variant. And then we can also see the Californian variant in the next slide. And it shows that more extended distribution, and in the parts of the city which are, have low levels of vaccination. Can I have next slide? And that's kind of shown here, that you can see that areas which have high levels of vaccination have actually less of these variants. And so the variants are cropping up where there is less coverage of the vaccine. And so it's imperative that we enhance the rate at which we vaccinate people, or people come forward to be vaccinated, so that we can curb this, what we call the wild type parent or ancestral virus, before it gets a chance to mutate and before these new variants crop up and infect people in our community. So next slide, please. We talked about this. Can we go to the next one, please? So finally, there is some good hope. So we did this sort of random survey of people and see if there was the vaccine hesitancy in our community. And what we found was that about 91% of the participants indicated that they would choose to be vaccinated. And most people who were hesitant was because they were worried about side effects and safety. We found that about 3% whites and 8% minority participants or indicated they would never choose to be vaccinated. They would, no matter what, and they would not be convinced. Minority participants were likely to choose vaccination with celebrity endorsement. So, and if the offerings are made in faith organizations and there were vaccine requirements, whereas white participants are more likely to choose vaccination if their families and friends or elected officials were vaccinated and there was increased evidence of efficacy. We also asked people where they would like to be vaccinated, and most people prefer to be vaccinated in their doctor's office or in some or pharmacy rather than even in hospitals or even faith-based organizations and so on. So I think there's hope, at least in Jefferson County. Of course, all surveys are biased, but we try to do the best we can doing it, randomizing it. So, but we think that this shows that there is a high level of vaccine acceptance within our community. So I'll end here, just remind that we do all this work because of the support from a lot of people, different sort of local philanthropic support, as well as foundation support from the city as well. And then finally, next slide, we have a lot of people who work in this project, people who are in at the university. We have a very large team, as you can see, and that we work with them collectively to do the best we can to keep track of what the virus is doing, how it is spreading, and what the variants are cropping up. Thank you.
Thank you, Dr. Bhatnagar. Two questions. One is this 91% number of people who would choose the vaccine is inordinately high now, isn't it, compared to what we're seeing around the country? So am I correct with that assumption? And B, any observations on that?
Yes, so this is higher than most other surveys. And the reason first is we think maybe we are polling only Jefferson County. So maybe in rural counties and outside the rates will be much lower. The second thing is when we send out letters and asking people what their opinions, maybe the people who respond are the people who are actually much more, should I say, likely to be involved in such public activities. Mm-hmm. And so people who don't really care wouldn't even respond to us. So I think the number is higher than what actually it is, but it's still substantially higher than we thought it would be.
Mm-hmm. And then a question about the variants. When you go to California, there's, I don't know, is it tens of thousands or hundreds of thousands of people now that are being impacted by the variants. Do we have an estimate here locally around the frequency of the variants?
No, we don't. In California, about 25 to 30% of the people are infected with this variant. We don't know what the wastewater is very difficult to tell what the level of infection in the community may be. And we would have to do sort of screening of clinical samples to be able to estimate prevalence in our community.
Gotcha.
But we can tell that it is quite prevalent, that we see it repeatedly. So it's not a one-off thing. So it is somewhat endemic to some of our communities.
Okay, so it's moved quite a bit. I think a month or so ago, maybe is when we diagnosed or we identified one variant, and since then we're seeing this scaling up very rapidly.
Yes, and it's amazing. It's been a month, and like you saw, we're keeping track. We're most concerned about the South African variant, which seems to be the most virulent and the most lethal, and also the Brazil variant. So we wanted to keep track to see if these don't crop up in the next few weeks. And so that's what the problem is. We thought that we will achieve herd immunity if we were just dealing with the ancestral strain. But now we have these new strains which have different efficacies with the vaccine, sometimes 6 to 10-fold lower efficacy than it is with the wild type or the ancestral strain. So then we do not know how we will achieve herd immunity if these new strains crop up, and certainly they take over.
Right, okay. All right, and that's what we're hearing from Dr. Walensky from CDC, and everybody's talking about this right now. So obviously, we got to be focused on doing the basics of public health. So thank you, Dr. Bhatnagar. There might be some more questions for you from the media here in a second. Let's switch over now and talk about vaccination and increase in vaccination. So U of L is going to be hosting a fabulous new mass vaccination site at Cardinal Stadium starting here very shortly. It's in partnership with state government. It's going to be the largest regional vaccination site in Kentucky. To tell us more about that is Dr. Jason Smith. He's the Chief Medical Officer for U of L Health and has been with us from before day one of this whole crisis. So Dr. Smith, thanks for everything you're doing and welcome.
Thanks for having me this morning. Appreciate it, Mayor.
All right, tell us what's going on.
You got it. Well, I saw a quick picture, Cardinal Stadium. We're going to be slightly down from there, although I'd love to have the entire stadium size people running through our vaccination site here in the next few days. We are going to be setting up the mass vaccination site in the purple lots, which is just outside of that stadium. So it's the big lots that are feeding the stadium parking during football games. And what we'll be able to do with the continued supply of vaccine from the state and from the national supply is do between 4,000 and 5,000 vaccinations per day at this Cardinal Stadium lot. And from that, we think over the course of that, 6 weeks or so, we can deliver almost 200,000 vaccinations here in the city of Louisville. And our hope is that, we can get this information out broadly, not just to the people here within Jefferson County, but also the surrounding counties, to provide that opportunity for anyone who wants it. We'll be accepting appointments starting, I believe, tomorrow on our website and via our telephone number that we're going to share here. That will be for 16 and older. So we are going to go down to age of 16. We will start signing up appointments on Wednesday, the 31st. And the vaccine site itself is going to open up on April 12th. And so we're looking to do around 24,000 vaccinations that first week is our goal. And so that's what we're going to continue to push for and continue to do. We are going to have 24 lanes of traffic moving through that site. So lots of people are here helping us. Lots of people are helping set it up. The city's helping, state's helping. It'll be a fantastic resource for our community, and we are just thrilled to be a part of it.
No, great job. Really appreciate. Well, you guys have stepped up from day one on this in so many different ways. So this is going to be something unlike anything we've seen before. It's going to be like LUVACs or broadband on steroids. So we're looking forward to seeing that. And then, is it too early to? I guess will you have all three of the vaccines coming through there, or how are you going to manage vaccines with that many people?
Yeah, well, we are not going to have all three. So I did say no to three. We'll probably have a combination of two, just because of the amount of vaccines that we're going to be doing. We will probably have some Pfizer vaccines to start with, and moving over to J&J later in the project to maintain being able to do this without second dose appointments and as we're closing up. But over the course of 7 weeks, we will probably have both of those vaccines moving into the community and through that vaccination site.
All right. And I've seen you in the community on weekends out at different churches and such. Give us a little bit of color about how that's going.
So that has been fantastic. We had an outstanding turnout this past weekend at the African American Heritage Center when we did that most recent community outreach. We had about 50 different faith-based organizations that help us kind of reach out to the community. Did almost 2,400 in a single day out at the Heritage Center, which was great. It was a fantastic experience. Well, we ran from about 9 o'clock till 9 p.m. I had a little bit of a line in the morning, but we were able to work through that and move everyone through. So it was great to be part of the community. It was fantastic because we've got a lot of student volunteers that come through from the medical school, from the nursing school, the School of Public Health here in Louisville that volunteer their time to help give the vaccines on the weekend. So it helps connect them in with the community on top of all of our staff that have been working out, tremendously hard, from pharmacy to the people that help set this up for us, to logistics for supplies. People have just donated time outside of their normal busy work lives to make these community events happen for us. And it's been fantastic. So we've still got more going forward. We've got some at the GE Union Hall coming up here in the next few weeks. We've got some down on the South End Community Center coming up. And we continue to work with other partners to make sure that we are moving into other areas of the community that are hit by this disease, and offering opportunities in those areas to make sure that people don't have difficulty traveling and having difficulty in getting where they need to go to get this vaccine.
Great. Okay, well, stay with us if you can. We'll have some more questions coming to you. And this new site at Cardinal Stadium complements another new community vaccination site, which will open in April, and that's in partnership with Norton, the state, and Humana. And that's going to be at Whitney Young Elementary School in the Shawnee neighborhood. So just more presence in the community. You're going to continue to see more and more physical presence throughout the community. So that brings me to another announcement. And with these new sites opening, we're going to transition our Metro Government Public Health and Wellness Department's vaccination efforts to a model that will allow us to bring the vaccine to more neighborhoods around the city more easily. So our LUVACs program at Broadbent Arena, when you think about how we started that up and where it's grown, featured in New York Times, Wall Street Journal, et cetera, as a best practice, it's really been enormously successful because of so many reasons. The public health department and the good work that they've done with Doctors Moyer and Hartledge and all the volunteers have come together there to do a great job. So now we can say with Cardinal Stadium opening up, since it's just really just a few short blocks away from Broadbent Arena, what is the smartest way for us to deploy our resources from the public health department's standpoint? So we are going to take LUVACs on the road and go out into the community and redeploy the resources to what we're calling LUVACs Mobile. That's going to represent pop-up sites around the city. And this is going to allow us to target resources to communities where there's significant numbers of people who can't easily get to Broadbent or Cardinal Stadium. So LUVACs Mobile is a significant part of our ongoing work also to ensure equity in vaccine distribution. So when you take a look at the map and you see those areas that don't have as much concentration of vaccines, those will be spots amongst others that LUVACs Mobile will be operating in. So it's a real great opportunity for us to improve on our equity numbers, which are doing pretty good, but we want to do better. And that's why we're taking LUVACs on the road. So we're going to make sure when people hear that they understand that if they've gotten their first dose at Broadbent, we're going to calendar that on out so they can get their second dose at Broadbent as well before it's fully decommissioned at Broadbent. So to talk more about the next evolution of our public health team efforts to vaccinate the people of our great city, I'd like to welcome Dr. Sarah Beth Hartledge. She's our Associate Medical Director, and Dr. Hartledge has been over the entire LUVACs operation at Broadbent, really working tirelessly. She's a physician, but I would say she's an entrepreneur as well, because when you see all the improvements that are taking place at Broadbent, it's quite impressive. They, gather their data and then they act and they improve. The volunteers there are doing an incredible job. So Dr. Hartledge, you're a real treasure for our city. Thank you very much for all the good work that you've done. So I can't wait to see what you're going to do with LUVACs Mobile. What's up?
Well, thank you for your kind words. So as you mentioned, the LUVACs team, including thousands of volunteers, has done a really amazing job taking care of, tens of thousands of people through the drive-through site behind me. But really, as a health department, our specific mission is to care for kind of the people on the margins, those with limited access and people at highest risk. And so we're going to be scaling down our operations at the arena and giving our last primary doses next Friday, April the 9th. We'll be continuing to give booster doses here at this site through the end of April, April the 30th. So just want to reassure everyone, if you're getting a primary dose from us, your booster dose is still here. There's no need to be concerned about that. But with that said, that's not the end of the LUVAC story. We're, as you mentioned, taking it on the road. So we'll be pivoting our focus and our resources to the LUVACs Mobile venture. And our mobile missions can be anything from 10 people to 1,000, and but they're designed, tailored to specific groups, including neighborhoods, demographics, various community organizations, and we are able to go out and meet people where they are to give them the best service and hopefully help us achieve that herd immunity by reaching into every corner of the city.
Okay, so major change in tactics, if you will, going from like a full-on onslaught at broadband to more guerrilla warfare, if you will, out into the community. So how about volunteers? Are you going to need volunteers when you go mobile, or what's that situation on that?
Absolutely. We are still going to be using volunteers. We're partnering with the Kentucky Nurses Association to help provide some of the workforce, but the volunteer slots will be able to be signed up for in the same way that people are signing up for volunteer opportunities here at Broadbent Arena. So the same platform, and there will be opportunities available there listed beginning today for people who are interested in participating in mobile missions.
Okay. And then you've piloted a few spots already with LUVACs Mobile. What are you learning?
Most of what we're learning is that people are excited to see you show up in their community. Dr. Smith would probably agree. When you show up and you meet people where they are, they're very happy to be able to get their vaccine and to see that the providers and the department cares about meeting them where they are. We went out to Hope Wellness this past Saturday with great success, and have some additional missions scheduled for later this week.
Very good. And how will people know where they can make appointments for LUVACs Mobile?
So it kind of depends on the mission, but we'll be keeping a calendar updated on our website, and we'll be able to take appointments by phone or over the internet. And many of our missions will also accept walk-ups without an appointment. And I did want to add, if you're part of a group that thinks you would be best served by a mobile mission and you would like to discuss getting one set up, you can reach out to us via email at LUVACsMobile@louisvilleky.gov. We'll put that on our website as well. But we would love to talk with you about your needs and see if we can help serve you.
And then how, Doc, we've had U of L, Norton Baptist, all doing community outreach vaccination. Now we have LUVACs Mobile. So are all three of the hospital systems going to continue doing that? And so how do you bring some clarity to this if I'm thinking I need a mobile operation in my part of town?
Yeah, so every provider is still doing the things that they've always been doing. So U of L and Norton and Baptist are still reaching out into the community and doing those events. We are also able to help make some of those connections. So if you reach out to us and we're not the best group to serve you, we may be able to help connect you with the teams operating mobile missions for one of the other providers as well.
Okay. Okay. Well, again, a big thanks to you, Dr. Hartledge, to the entire public health department here from the city of Louisville, really rising to this occasion with this historic opportunity and threat from the pandemic. We are not done, but we certainly have a plan that we continue to execute. So thank you for that. Let's roll into our media questions now, Jess.
Okay, thanks, Mayor. The first two questions in the chat are regarding Cardinal Stadium. So we'll throw those over to Dr. Smith. Sarah Ladd with the Courier-Journal says, when Dr. Smith says 16 plus can get appointments at Cardinal Stadium, is that the 16 plus with high risk conditions or everyone 16 plus?
Yeah, we're planning for everyone 16 plus. Remember, we're planning on opening up Cardinal Stadium to start the vaccinations on April 12th. And by that time, we should be open to all people that are getting or needing the vaccine. So it doesn't make sense for us to limit those appointments. So we're going to open it up to everyone over the ages of 16. Feel free to sign up or call, sign up online or call the information there and we'll get you an appointment made.
Thanks. I'd like to remind media, if you have any questions, please place them in the chat. Our next question comes from Kate Springer with WDRB. This one's for Dr. Smith as well. She says, who will be staffing the Cardinal Stadium vaccine clinic and how many people are needed to keep that size of an operation going?
Yeah, great question. So we've got fourth-year medical students that we've hired as they've completed their medical studies. They're actually going to work for us for a few months before they start internship. We've got our nurses and physicians that are providing time to this, and we're also staffing some of our hospital nurses into these areas. So from a clinical standpoint, we need about 24 people for 9 hours every day vaccinating, give or take. And so we've got a huge pool of volunteers that are willing to help out. For those 24 people are really only the tip of the sword, as I'm sure Dr. Hartledge can tell you, as far as making that operation run. So we've got resources from AmeriCorps who are going to come and help us on site. We've got some National Guard resources that are helping us as far as maintaining traffic in that area. And then we've got our own folks who've generously stepped up and donated time from the University of Louisville, from surrounding organizations, as well as from our hospital. They're going to help on the ground as far as making sure that the ground operation works. If you look at our overall staffing, we have a little over 100 people per day deployed at that site, working and maintaining an operation of that size. So a lot of moving parts. Someone suggested that we get colored vests like they have on aircraft carrier decks to move around. I'm not quite sure we're going to do that yet, but there's definitely a lot of people to keep track of in a site this size.
Thanks, Dr. Smith. The next question is for Dr. Hartledge about LUVACs Mobile. Sarah Ladd with the Courier-Journal asks, will LUVACs Mobile be effective, official immediately, or only after the second doses are done at Broadbent?
So our mobile program has actually already had a soft launch. We've done some events already, have some more on the calendar going into the next days and weeks. So it's definitely official right now. Our capacity will continue to increase as our operations at the arena continue to wind down, but we are out in the community operating right now.
Dr. Moyer, the next question is for you from David Mattingly with Wave 3 News. He asks, this is for Dr. Moyer regarding the CDC warnings of a possible new wave of cases. What is being done in preparation for this possibility?
So great question. I would say everything that you heard about today, as you heard from Dr. Bratnagar, we know that there are a higher number of variants in our areas of town that have lower vaccination rates. And so just trying to get our entire community vaccinated as quickly as possible. So encouraging anyone who's older than 16 that has a chronic medical condition and anyone over 40, no matter what your status is, to sign up for an appointment today. We do have availability with our partners. Check out our website. I know Norton's got availability, some of our pharmacy partners as well. And then if you are 16 and above and don't meet the 1C criteria, log on to Dr. Smith's website tomorrow and sign up for an appointment as soon as you can at the Cardinal Stadium. And just we're in a race against time to get our entire community vaccinated because we know that's the best prevention in preventing the spread of variants.
Okay, Dr. Smith, we're coming back to you for this last question. Paul Miles with 840 WHAS says, with COVID case counts declining for the 11th straight week in Kentucky, is U of L Health scaling back its staffing or COVID protocols in the hospitals? And how has the decline affected your operations?
Well, first of all, the decline has basically given us just a little bit of breathing room across the healthcare system. I think that's the biggest thing that we've seen. As far as staffing, no, we're not really changing the overall staffing models because this is really going to be the new way we take care of things moving forward. I think if you look across the country, we're never going to be completely rid of COVID. It is going to be something that stays with us, and it becomes, if we're lucky, a little bit of a seasonal disease moving forward and less of a pandemic. But we're always going to have patients in the hospital now with this. It's going to be part of what we deal with every day, every week. We are looking at our visitation policy. I think that's the biggest thing I remind everyone is that, you know, we still have a very, very strict visitation policy. And of all the things that we had to do during the pandemic to care for people and keep everyone safe, that is the one thing that to me was almost as difficult to enact as it was to protect us. And so from that standpoint, we are looking to increase our visitation policies across our healthcare system in the upcoming weeks. But we're moving as fast as we can to try and open up some of the normal hospital operations as best we can.
Thank you. Our next question is from David Mattingly with Wave 3 News, and Dr. Bhatnagar will ask you to answer this one. It's about variants. David asks, are variants the most likely source for an increase in cases? And what role could spring break exposures outside the state play in increasing COVID cases here?
Yeah, so because all the variants are at least 2 to 4 times more infectious than the ancestral strain, then they would certainly be expected to spread more rapidly than the old variety, the good old virus that we had to deal with before. So certainly, even with the same amount of infection, the spread is going to be larger. So therefore, we have to be careful about that, and that's what has happened in other states. And certainly, because few of these are homegrown, they're coming from other states, that visitors from other places are likely to introduce these, especially spring break. There is a new variant that was detected in New York, which was actually only found in older people who had recurrent health problems. But there are lots of other variants that are very rare. Both of them, the UK variant, the South African, and the Brazil variants, are very rapidly being transmitted over the place because in young people as well. In Florida, in particular, there is a high incidence of the Brazil variant. So people going to spring break in Florida coming back are likely to bring that to a community. But we'll keep track of that.
Okay, thank you, doctors. Mayor, that is the last question in the chat.
Okay, well, I want to thank everybody for joining us today and remind us all that we need to be cheering for the Lady Cards tonight as they play Stanford in the Elite Eight, and also vote for Dana Evans for Player of the Year. She's had a heck of a career here at U of L, and give us something all to cheer forward to. As we're playing two Cardinals. The Stanford Cardinals are a tough team. I think they're #1 in the country right now, but there's no reason why we can't take them down. So tune in at 9 o'clock and let them hear us yell from Louisville down in San Antonio where they're playing. So thanks everybody for tuning in. Stay safe. Let's stay focused here as we drive this virus out of the community, and stay strong. Take care.